It's Liz Palmer, and I'm just doing my sterile dressing change with gloves. And my friend Kim is filming me. She's going to do an environmental check for you, and then we'll start. Okay, so the first thing I would do, Christy, is I go to the nursing station to check the chart for my patient. My patient's name is Sid Garland, and he was admitted to hospital recently because he had an appendicitis and had to have an appendectomy. When I'm checking the doctor's orders, he's ordered a sterile dressing change using gloves. I would write down Sid Garland's first name, last name, his birth date, his allergies, and he is allergic to penicillin and to codeine. And I would write down his MRN. I would then go to the supply cupboard and get the items I need. So I need dressing tape, clean gloves, sterile gloves, 2x2 gauze pad, 4x4 gauze, an abdominal pad, a dressing tray, along with normal saline as per the doctor's orders. I would then go to Mr. Garland's room.
Come on in.
Hi there. I'm Liz Palmer, and I'm a practical nursing student from Durham College, and I'm here to change your dressing today. Is that okay with you?
Yeah, sure.
Okay, so just before we get started, are you in any pain?
No.
And do you have to go to the washroom at all?
No, I think I'm good.
Okay, so I need to find out some information. Can I see your armband?
Sure.
And can I ask you your first name and your last name?
It's Sid Garland.
And when is your date of birth?
It is November the 8th, 1965.
And do you have any allergies?
I do, to codeine and to penicillin as well.
Okay, and then I would also check his MRN on the band and what I've written down. So I do have the correct patient. The information he gave me matches what I wrote down, which matches his chart, so I can begin. So I would do an environmental check, make sure there's no clutter, make sure the bed brakes are on and that they're working, make sure that the side rails are on and that the oxygen and the suctioning is also working. Then I would close the curtains for privacy, but also once I start the sterile field, I would try to minimize any airflow over the field. And I would ask if Mr. Garland is comfortable, and I'd move him just a little bit closer to me, and I would keep him covered for his dignity. The next thing I would do is, can I use your bedside table?
Certainly.
Okay, so once he does, I bring it over to the side and make it like a triangle. And so my sterile field would go here, the patient's here, and the garbage would be here. Mr. Garland, do you mind if I put the garbage over here?
No, that's fine.
Okay, so before I get started, I would raise the bed to waist height, and I would also have the bedside table at waist height before I begin opening the sterile tray. And with that, I will start opening. So the first thing I do is I would take the first flap and open it away from me, making sure I'm only touching the 1-inch border. I would take the second flap and open it, only touching the 1-inch border. Along with the third flap, only touching the 1-inch border. And I would take the fourth flap, but I have to be careful because there are transfer forceps in there. Touching the 1-inch border. Now, I want to adjust a little bit so it's square. And again, I'm only touching the 1-inch border. And then I would begin to organize my field and my trays. I'm going to take off the sterile drape. And Mr. Garland did indicate that it was okay for me to put the garbage at the end of his bed. So I'm going to get the garbage bag out of the tray and put my forceps down so the tips are well within the 1-inch border. I'll then pick up my forceps again and I'll organize my tray. So I'll remove the gauze and I will organize the forceps so that the tips are pointed down. And again, I'll put my forceps down. Now I'll start adding to my field. So I would check my abdominal pad, check the seal on it, feel it like a banana, place it on the field. Add 4x4 gauze. And each time I'm checking the packaging to make sure that it's not wet, the seal is not broken. And then everything is still sterile. Check my 2x2. Feel like a banana. Okay, and then I need to add some normal saline to the tray. So I'm looking at the label, and it is not, it hasn't expired, so I can use it. I will take off the lid and put it face up. I will lip it into the garbage. And then I will pour some into my tray. Now the next thing I need to do is don clean gloves to remove the current dressing. So I'll remove the tape very carefully. I'll make sure I move it away from the patient. And then I will use my forceps to remove the 4x4 gauze dressings, pads it on. So as you can see, there's a large amount of serous sanguinis exudate on 2 4x4 squares. I'll drop that into the garbage along with my forceps, and I'll remove my clean gloves. And drop them into the garbage. I will then don sterile gloves. Being careful, I'm opening it like a book, and I'm being careful only to touch the flaps, the 1-inch flaps. So the first thing I'm going to do is I'm going to grab the cuff and wiggle my fingers in. Being careful to only touch the cup. I'll then cup adjust them for the. Okay. Then I will add the sterile drape. So that I can extend my sterile field. And then what I will do is I will clean the wound using my forceps. So I will do top to bottom in the middle. I'm careful to keep my tips pointed down, top to bottom distal. And top to bottom proximal. I'll then dry the wound. Down the middle. Distal. And proximal. And I will put the forceps down. They will have to go into the sharps container. And I would assess the wound so it is well approximated. There's 21 stitches that are intact, and it's just slightly pink, so it looks normal. And the patient is reporting that there's very little pain, so it looks like it's healing well. Now with that, I will then add a new dressing on top, so I'll use the forceps to add cover the wound. I would remove this sterile dressing because it just, or sterile drape because it seems to be getting in the way. I would then add the abdominal pad, touching the outside where the blue stripe is. I would use my tape to secure it down. So I'd go across the whole wound, but unfortunately I don't have enough tape to do that. But one at the top, the middle, and the end to secure it. I would make sure that I lower the bed down to the regular height. I make sure the call bell was in place. I'd remove the, I would lower the bedside table also down to the proper height, the bed to the lowest level, call bell in place. And I would clean up the metal. Forceps would go in the sharps container and the rest would go in the bio waste container. I would go to the nursing station to chart that the wound was well approximated and healing well. There were 21 stitches intact, and that Mr. Garland tolerated the dressing change well. And with that, I would say, Mr. Garland, is everything okay? Any pain now?
No, that's fine.
Do you need help with anything? Do you need to go to the washroom?
No, I think I'm still all right.
Okay, your call bell's there, and if you need anything, just hit the call bell and I'll come back to help you.
Okay, will do. Thank you.
Thank you. And that is the end of my sterile dressing.